Hello, Medicos. Good day to all of you. This is Dr. BK for you, and today I am going to discuss one of the most interesting topics in the head and neck and the parotid gland. So, with respect to the parotid gland, our learning objectives for today will be mainly a short introduction about the parotid gland, its situation, then the coverings of the parotid gland, that is the capsule, the true and the false capsule of the parotid gland. Then we will be discussing about the presenting parts, the various parts, surfaces, borders of the parotid gland. Then we are also going to actually understand the various structures which are passing through the parotid gland. So within the parotid gland, what are all the structures are present? And then followed by that, we will be discussing about the nerve supply of the parotid gland. And finally, we will end today's session with the discussion on the clinical aspects. Okay. So now, you all know that the parotid gland is one of the salivary gland, and it is the largest salivary gland of the three salivary glands. So here you are able to see the parotid salivary gland, and then here you are able to see below the mandible is the submandibular salivary gland, and below the tongue you have the sublingual salivary gland. Of the three salivary glands, the parotid gland is the largest gland. Now why actually it is labeled as parotid, which means parotid gland? It is around the ear, external auditory meatus or acoustic meatus. So since it is molded to that bone, external acoustic meatus, parotid, around the ear, it is actually labeled so. So it is a soft, yellowish, irregular mass of tissue, roughly inverted pyramidal in shape. Okay, and it is flattened because it is molded onto the surrounding structures, which forms the parotid bed. They are called as the parotid bed structures, to which the parotid gland is molded, or it rests on these structures. Okay, so now let us try to understand the parotid bed or the boundaries of the parotid region. So here you are able to see the outline of the parotid gland is superimposed on the surrounding structures. So anteriorly, mainly it is related to the ramus of the mandible, and the gland itself actually is molded to the ramus. Okay, so it somewhat folds onto the posterior border, around the posterior border of the ramus of the mandible anteriorly. Okay, so that is one of the boundary which you are able to see here. Posteriorly, same way it will be molded to the mastoid process and the structures emerging from it. So from the external surface you will have the sternomastoid muscle. From the deeper aspect of the mastoid process you have the posterior belly of digastric. So that will form the posterior limit. Superiorly you are able to see the external acoustic meatus, mainly formed by the tympanic plate of temporal bone, and you are able to see the capsule of the temporomandibular joint. Okay, so that will form the superior limit or bed of the parotid gland, and that is why what happens, this part, which is also called as the base of the gland, this surface is actually considered as the base of the gland. It is very much molded for this tympanic plate of temporal bone, external acoustic meatus. So anterior boundary posterior boundary and superiorly I have told you. Medially, you see the styloid process. So styloid process and the muscles and ligaments attached to it is actually called as the styloid apparatus. The process together with the muscles. So three muscles are attached: stylohyoid muscle, styloglossus muscle, and stylopharyngeus ligament. Sorry, stylopharyngeus muscle, styloglossus, stylohyoid, and stylopharyngeus muscle. Two ligaments. One you are able to see. Again, I will be actually mentioning this ligament, stylomandibular ligament, which extends from the styloid process to the angle of mandible. It is a modification of the investing layer of deep cervical fascia. This is the stylomandibular ligament, thickening of the investing layer of deep cervical fascia. This ligament separates your parotid gland from the submandibular gland, which is labeled here. So this is the situation of the submandibular gland. So medially styloid process and structures attached to it, as I told you. So then below you have the posterior belly of digastric, and above, as I told you, external acoustic meatus and the capsule of temporomandibular joint. So below you are able to see that is the posterior belly of the digastric muscle, and the stylohyoid muscle is very much intimately related to it. So now we have understood the boundaries or the structures forming the parotid bed. The gland actually rests. Now, when we have discussed about these boundaries, the gland not only limits to itself within these entity or the boundaries, but it extends. So for example, a part of the gland you are able to see extending on top of the masseter muscle. Same way it will actually overlap to some extent on the posterior belly of digastric. The apex might extend downwards into the upper part of the neck, okay, into the carotid triangle. So it is, what I mean to tell is, it is not strictly confined itself, but there are extensions. Apart from this, there are also processes of the gland, which various process which also extend beyond the limit of the parotid bed or the parotid region. So now let us discuss about the coverings of the gland. So since it is a gland, it will be invested by a capsule. It has got a true capsule and a false capsule. So the true capsule is mainly the condensation of the fibrous stroma of the gland. So as a rule, any gland you take, the true capsule is the condensation of the fibrous stroma of the gland. With respect to the false capsule, above the true capsule you have the false capsule. The false capsule is mainly formed by the splitting of the investing layer of deep cervical fascia. So the deep cervical fascia investing layer, after covering the neck, if you trace it above, at the lower border of the mandible it splits. Now in the region of parotid gland, it splits into a superficial layer and a deep layer. So the superficial layer is actually called as the parotidomesenteric fascia, and it is a very strong and thick layer. It is attached to the lower border of the zygomatic arch. So this part of the superficial layer also merges with the epimysium of the masseter muscle, forming a strong parotidomesenteric fascia. Whereas the deep layer, which passes to the deeper surface, deep to the medial surface of the gland, is not very thick but comparatively thin, and it is attached to the styloid process and the tympanic plate. Okay, so the deeper part of the investing layer, the deeper layer, attaches to the tympanic plate and the styloid process. Now it is this deep layer which thickens from the styloid process to the angle of mandible as the stylomandibular ligament. So stylomandibular ligament is a thickening of investing layer of deep cervical fascia. Okay, so that is about the true capsule and the false capsule. So next we will pass on to the presenting parts. The parotid gland, the following presenting parts are actually recognized on gross examination. It has a base, apex, which is directed downwards. Base is actually directed upwards, so that is why it is considered as an inverted pyramidal shape. It has an apex base, superficial or lateral surface. So what you are able to see here is the superficial or the lateral surface. Then the other two surfaces which I have mentioned, anteromedial and posteromedial surface, is not seen in this view. Okay. Then you have three borders: anterior border, posterior border, okay, anterior border, posterior border, and one more border, medial border, is again not seen in this view. Anyway, we will discuss about these surfaces, borders, one by one. Now first coming to the base. So as I told you, the base is molded to the external acoustic meatus. So the base is somewhat grooved. Okay, so it is molded or grooved by the external acoustic meatus. And what are the structures emerging from the base? So that is your superficial temporal vessels. You are able to see the superficial temporal vessels with the auriculotemporal nerve. Superficial temporal vessels and auriculotemporal nerve. Superficial temporal artery is a branch of external carotid artery. Okay, auriculotemporal nerve is from the mandibular division of trigeminal nerve. Both supply the scalp. Then apart from that, you also come across the temporal branch of facial nerve. Okay, you come across the temporal branch of facial nerve. So that is the auriculotemporal vessels and the superficial temporal vessels and the auriculotemporal nerve. And this is the temporal branch of the facial nerve which emerges from the base of the gland. So these two are the structures which are emerging from the base of the parotid gland. So next coming to the apex. Okay, so apex of the parotid gland, the lower end, so it overlaps the posterior belly, and not only that, it extends to the carotid triangle also. So sometimes it is seen in the uppermost part of the carotid triangle. Now what are the structures emerging? Is your cervical branch of facial nerve. Okay, so the cervical branch of facial nerve emerges from the apex. Then commencement of external jugular vein. So that is the external jugular vein just starts after it is formed. It is formed by the union of this posterior auricular vein with the posterior division of retromandibular vein. Okay, with the posterior division of retromandibular vein. Okay, so there is a small mistake here. So it is should be posterior division, instead it is given as anterior division. So kindly make a note of it. It is actually the posterior division of retromandibular vein actually joining with the posterior auricular vein to form the external jugular vein. So the commencement of external jugular vein and the emergence of the cervical branch of facial nerve. So these two are actually seen in the apex of the parotid gland. Next, coming to the lateral surface. So this is the parotid gland. Part of the parotid gland is cut to expose the masseter muscle with its deep fascia covering the masseter muscle. So coming to the surfaces, first the superficial or the lateral surface. So from above downwards or superficial to do, it is covered by the skin. superficial fascia. Then you have the false capsule, which is formed by the investing layer. So this fuses with the epimysium of the masseter to form the perotido-masseteric fascia. Okay, so it actually forms the perotido-masseteric fascia. So the gland and the muscle, what happens is it forms a continuous sheet and attaches to the lower border of the zygomatic arch. Then apart from that, on the surface you come across parotid lymph nodes. So you're able to see the parotid lymph nodes. So sometimes it might be outside the capsule, or sometimes it might be a little deep buried in the gland. Parotid lymph nodes you are able to see, and branches of great auricular nerve. So branches of great auricular nerve are also seen on the superficial or lateral surface. Okay, parotid lymph nodes and the branches of great auricular nerve. So here you are able to see the great auricular nerve, which divides into anterior division and posterior division. So this great auricular nerves is actually a sensory nerve, and it is responsible for supplying the skin over the mandible, and it also conveys sensory fibers from the parotid gland. So we have finished about the apex of the parotid gland, the base of the parotid gland, and then the superficial or the lateral surface. So now let us move on to the anteromedial surface. So if you take a horizontal section, then you will understand the anteromedial surface. So this part what we have seen is the superficial surface. So now you are able to see the anteromedial surface, which is molded to the ramus of mandible. So this is the ramus with its posterior border. The external surface of ramus, you have the masseter muscle, the posterior part of the masseter muscle. Medial surface, near to the angle, you are able to see the medial pterygoid muscle. Okay, so you are able to see that is the masseter, and this is the medial pterygoid muscle on the either side of the ramus of mandible. So anteromedial surface is actually related to the ramus and these two muscles. Okay, so masseter, posterior border of ramus of mandible, and then the medial pterygoid muscle. The facial nerve actually crosses the outer lip of this surface. Okay, so we will come to the course of the facial nerve at the later part of this class. Along the outer lip, what happens is the facial nerve passes from the posteromedial surface only, it enters the gland, but it is seen on the outer lip of this surface. Okay, outer lip of this grooved surface you are able to see. Whereas the inner lip of the grooved surface will be related to the maxillary artery, one of the terminal branch of the external carotid artery. So that is about the anteromedial surface. Next we will move on to the posteromedial surface. So this is the superficial or lateral surface we have seen. Then this we have seen the anteromedial surface, which is related to the masseter, ramus of mandible, and then this is your medial pterygoid muscle. This is the medial pterygoid muscle. Outer grooved surface you are able to see the facial nerve. Inner grooved surface, inner lip of the grooved surface is the maxillary artery, which is a branch of external carotid artery. This within the mandible you are able to see, that is the mandibular it is actually the nerves and vessels which might be taken at a more lower plane. Inferior alveolar nerves and vessels which are actually passing through the mandibular canal. This is the posteromedial surface. It will be related to the mastoid process. So outer part of the mastoid process, external aspect, the sternocleidomastoid muscle, and then you are able to see the inner aspect is the posterior belly of digastric. More medially you go, you have the styloid process. with the structures attached to it that I told you, the styloid apparatus, 3 muscles and the 2 ligaments. This is your carotid sheath in a deeper plane with internal jugular vein, internal carotid artery, anterior, vein posterior. In between these two is the vagus nerve. Okay, so posteromedial surface is related to the mainly to the styloid process. So what happens is, deep to the styloid process, you are able to see the internal carotid artery and the pre-styloid part of the gland. Okay, post-styloid part of the gland is actually related to the internal jugular vein. Okay, pre-styloid part artery and post-styloid part, so which is in front and behind the styloid process. So now you are able to see the parotid gland removed. So that is your internal carotid artery and your internal jugular vein. This is your styloid process. Pre-styloid part of the gland will be related to internal carotid artery. Post-styloid part will be related to the internal jugular vein. Between these two, you have the last 4 cranial nerves emerging. So anteriorly, you are able to see the hypoglossal nerve. This is your 11th cranial nerve, spinal part of accessory nerve. Okay, and then this is your vagus nerve. You are able to see that is the vagus nerve, and one more nerve is the glossopharyngeal nerve, which is in a more deeper plane but will give a branch to the carotid body, carotid sinus. So last 4 cranial nerves, 9th, 10th, this is 12th and 11th and 12th, 10, 11 and 12. So this is 11, 10 and the 12th nerve. Last 4 cranial nerves will be related since it is present between the internal carotid artery and the internal jugular vein. Okay. More deeper plane, you come across the rectus capitis lateralis muscle with the transverse process of the atlas. So we have finished about the surfaces of the gland. Now we are actually moving on to the borders of the gland. There are 3 borders: anterior border, posterior border and medial border. So first we will try to understand the medial border, which separates the anteromedial surface from the posteromedial surface. So anteromedial surface we have seen molded to the ramus. Posteromedial surface we have seen molded to the mastoid process with the sternocleidomastoid and the posterior belly of digastric. This is your styloid process. You are able to see here with the 3 muscles: stylopharyngeus, styloglossus and stylohyoid muscle, and 2 ligaments are attached to it: stylohyoid ligament and the stylomandibular ligament. More deeper plane, you can see the internal carotid artery and the internal jugular vein and the last 4 cranial nerves. The medial border is actually related to the lateral wall of the pharynx. So that is why sometimes this medial border is also called as the pharyngeal border. Okay, it's also called as the pharyngeal border. This is the facial nerve which is actually entering the gland via the posteromedial surface. So we will come to it later. The next border which you are able to see here is the anterior border, which separates the superficial or lateral surface from the anteromedial surface. Okay, which separates the lateral surface from the anteromedial surface. So mainly, we are discussing about the posterior border. It separates the posterior medial surface from the lateral surface. It is related to posterior auricular vessels and nerves. Posterior auricular vessels and nerves is related to the posterior border, and the facial nerve emerges deeper to this border. Okay, so posterior auricular artery is a branch of external carotid artery. Then you have the posterior auricular vein, which is going to join with the posterior division of retromandibular vein to form the external jugular vein. Okay, So auricular is posterior. Also there is one more small muscle. So mainly it is related to the posterior auricular vessels and nerves, the posterior border, which is overlapping over the sternocleidomastoid muscle. So medial border, and then this is the posterior border. Now coming to the anterior border, which you are able to see here. So it separates the superficial or lateral surface from the anteromedial surface, and there are so many structures which are emerging from above downwards. Mainly the zygomatic branch of facial nerve. Okay, so it is the zygomatic branch of facial nerve which emerges. Then you have the superficial temporal artery. Okay, so you have the transverse facial artery, zygomatic branch of facial nerve, and transverse facial artery. Then upper buccal branch of facial nerve, followed by the parotid duct. Upper buccal branch of facial nerve, followed by the parotid duct. Then you have lower buccal branch of facial nerve, and also below that you have the marginal mandibular branch. Now, above the parotid duct, sometimes you come across the accessory parotid gland and its duct. Between the main duct and the zygomatic arch, you come across the accessory parotid gland and its duct. So, structures emerging from the anterior border of zygomatic branch of facial nerve. Then you have the transverse facial artery, upper buccal branch, parotid duct, lower buccal branch, and marginal mandibular branch. These are the structures emerging from the anterior border. Next, coming to the processes. So there are many processes. Main process is the accessory parotid gland, which you come across immediately above the parotid duct, and sometimes it also has its accessory parotid duct. Okay. The other process or an upward extension is called as the glenoid process. Okay. Then you have a facial process. Then you have a pterygoid process. So facial process, it will extend over the masseter muscle. Glenoid process will extend above. Okay. Between the external acoustic meatus and the capsule of the gland. The pterygoid process is at a deeper plane between the ramus of mandible and the medial pterygoid muscle. Okay, so these are the various processes of the gland, and most commonly occurring is the accessory parotid gland. It is nothing but the detached part which you see between the parotid duct and the zygomatic arch. So next, most importantly, is the structures present within the parotid gland. So mainly you come across from superficial to deep facial nerve. Then intermediate is the retromandibular vein formation, and then in a more deeper plane is the external carotid artery dividing into two terminal branches. So first, the facial nerve after its exit from the stylomastoid foramen. Okay, so after its exit from the stylomastoid foramen, what happens is it enters the posteromedial surface and then divides into two trunks. Okay, one is the temporofacial trunk and another one is the cervicofacial trunk. Now from the temporofacial trunk you have the temporal branch and the zygomatic branch. From the cervicofacial trunk you have the buccal branch, marginal mandibular branch, and then the cervical branch. So these are the 5 branches which actually emerge from the parotid gland. Through the posteromedial surface they come, and then they divide into 5 branches: temporal, zygomatic, upper buccal, mandibular, and cervical. Temporal actually emerges from the base, cervical from the apex, zygomatic, buccal, and mandibular from the anterior border. Buccal divides into upper buccal and lower buccal, which is above and below the parotid duct, which is above and below the parotid duct. Now, the entrance of the facial nerve actually divides the gland into a superficial and a deep part, and both are connected by the intermediate isthmus. So the part connecting the superficial and deep part is actually considered as the isthmus of the parotid gland. So in a superficial plane you have the facial nerve dividing into the two things. The one is the cervico temporofacial trunk, and another one is the cervicofacial trunk, which finally gives rise to the 5 branches. They are like the spread fingers of our hand. Next is the retromandibular vein. So it is formed by the union of superficial temporal and maxillary vein. It is present at an intermediate level, and this again divides into anterior and posterior division. Anterior division of retromandibular joins with the facial vein to form the common facial vein. Posterior division of retromandibular joins with the posterior auricular vein to form the external jugular vein, which actually emerges from the apex of the parotid gland. Okay, so that is about the retromandibular vein, which is formed within the substance of the parotid gland, which is deep to the facial nerve. The more deeper plane, set in a more deeper plane, is the external carotid artery, which divides into maxillary artery and superficial temporal artery. Okay, so the external carotid artery divides into two terminal branches, the maxillary artery and the superficial temporal artery. The superficial temporal artery again gives a small branch, which is the transverse facial artery, which emerges from the anterior border of the parotid gland. Okay, so here are able to see in a more deeper plane the external carotid artery dividing into the maxillary artery and the superficial temporal artery. This is retromandibular vein, anterior and posterior division. This is actually the facial nerve. So from superficial to deep, it is the facial nerve, retromandibular vein, and then the external carotid dividing into two terminal branches. So transverse facial artery is an accessory artery which supplies the face, blood supply to the face, but the chief artery to the face is the facial artery. Next, parotid duct, also called as the Stenson's duct, emerges from the anterior border of the gland. It is 5 centimeter in length, passes over the masseter, and then after the anterior border, crossing the anterior border of the masseter, it abruptly turns medially to pierce the buccinator and the fascia covering the buccinator, buccopharyngeal fascia, and then enters the mucous membrane. To some extent, it actually runs over the mucous membrane as an oblique course, and then finally pierces the mucous membrane and opens into the vestibule of the mouth opposite the upper second molar tooth. Okay, opens into the vestibule of the mouth at the upper second molar tooth. Okay, so this oblique course, intramucal course, which has a oblique course, naturally acts as a sphincter for this duct, so that any food particles or something does not enter into the duct in a reverse manner. Okay, so that is about the parotid duct or Stenson's duct. So the surface marking will be a 5 centimeter line, 1 finger breadth below the zygomatic arch in front of the tragus of the ear. In front of the tragus of ear, 1 inch below the zygomatic arch, you can see the surface projection of the parotid duct. So blood supply is mainly branches from the external carotid artery, and venous drainage is by the tributaries of the external jugular vein. So lymphatics, mainly parotid lymph nodes, which are seen on top of the gland. Sometimes it is present superficially, sometimes it is buried within the substance of the gland. So lymphatics from here, ultimately what happened, they drain into jugulodigastric nodes. Efferents from the parotid nodes, they drain into the jugulodigastric nodes. So now coming to the parasympathetic supply. So any gland should have a parasympathetic supply. Most of the glands, your salivary glands, pancreas, Okay, it is called a secretomotor pathway. So secretomotor pathway or parasympathetic supply is mainly the ganglion concerned is the aortic ganglion, which is intimately related to the mandibular division of the trigeminal nerve. So where does it receives the fibers? The fibers mainly come from the inferior salivatory nucleus. So the inferior salivatory nucleus is the nucleus for this parasympathetic supply. The upper part of medulla are sometimes considered as the lower part of the pons. So the fibers emerge via the ninth nerve, glossopharyngeal nerve. So this is the ninth nerve emerging from the medulla. It has two ganglia, superior ganglia and inferior ganglia. From the inferior ganglia, it passes by the tympanic branch and takes part in the tympanic plexus, which is in the middle ear. In the medial wall of the middle ear, you have a tympanic plexus. Then, from the tympanic plexus, a branch will emerge the roof of the middle ear as lesser petrosal nerve. This nerve only comes out of the foramen ovale, meal structures of the foramen ovale, mandibular nerve, emissary vein, accessory middle meningeal artery, and lesser petrosal nerve is the preganglionic nerve fibers to the parotid gland. So that fibers will come and relay in the aortic ganglion, which is a peripheral parasympathetic ganglion intimately related to the trunk of mandibular nerve in the infratemporal fossa. Postganglionic fibers pass via the auriculotemporal nerve. You are able to see the nerve arises by two roots. So it passes via the auriculotemporal nerve. So the nerve actually grooves and emerges from the base of the gland to supply the scalp. So they carry parasympathetic fibers and supply to the gland. So that is the parasympathetic pathway. Inferior salivatory nucleus, glossopharyngeal nerve, tympanic branch, taking part in tympanic plexus, lesser petrosal nerve relaying in the aortic ganglia. Postganglionic fibers via the auriculotemporal nerve supply the gland. Now, the gland also has got a sympathetic supply, vasomotor. They arise from the lateral horn cells. Okay, so they arise from the lateral horn cells of the thoracic, upper thoracic segments of the spinal cord. Okay, upper thoracic segments, thoracic nerves, T1 to T4 nerves is mainly responsible for the sympathetic innervation. So these fibers, preganglionic fibers from the lateral horn cells, they relay in the cervical sympathetic chain. So here you are able to see the cervical sympathetic chain, superior, middle and inferior ganglia. So mainly the preganglionic fibers, they go to the inferior ganglion. Postganglionic fibers from here will travel via the plexus around the external carotid artery. Okay, so they actually travel via the plexus around the external carotid artery and then they reach the gland. So sympathetic is from inferior cervical ganglion. Preganglionic fibers is from the lateral horn cells of the upper four thoracic segments. Sensory supply is by the great auricular nerve. Okay, so gland is actually from great auricular nerve and also from the auriculotemporal nerve, which itself is a sensory nerve as it passes through the base of the gland. So it also conveys sensations from the parotid gland. So the auriculotemporal nerve and the great auricular nerve, which is seen on the superficial surface. Coming to the clinical aspects. So swelling of the parotid gland, which is inflammation of the parotid gland, most commonly seen in viral infection, mumps. So mumps is actually a viral infection in which the gland becomes swollen. Now this swelling, what happens is very much painful because the false capsule which is seen over the gland as the parotidomesenteric fascia is a very tough layer and it does not yield to this swelling. So since it is not yielding and the fascia is stretched, and since it is a strong fascia, what happens is there is tremendous pain over the parotid gland. Okay, complication of mumps, sometimes it might also spread to the testis. So other inflammations, mainly swelling of the gland, as I told you, other conditions also it might get swollen, any infections. So tumors of the parotid gland are also common. Mixed parotid tumors are slow growing benign tumors. Okay, so they are called as mixed tumors, slow growing benign tumors. So parotidectomy, so removal of the parotid gland in parotid tumors or sometimes in crush injuries of the parotid gland, it should be very careful uh, to remove the gland, especially care should be taken to avoid injury to the facial nerve. So if the facial nerve is actually damaged, then naturally the patient might go for Bell's palsy or facial paralysis. So that is why immediately after any surgeries of the parotid gland or parotidectomy, the patient is asked to actually test is done for integrity of the facial nerve by asking the patient to perform various facial movements like opening the mouth, closing the mouth, blinking the eyelids, and so on, and drawing the angle of the mouth to the either sides. So parotidectomy, it should be very careful, and a modified surgical technique called as Hilton's method is performed. A small transverse incision is actually made. So parotid abscess, as I told you, mainly is done by the Hilton's method. So drainage of pus in abscess mainly is by a small transverse incision. Superficially it is made to drain the pus. Next, coming to the Fraze syndrome. So if the parotid gland is damaged in some penetrating wounds or injuries, when the fibers, parasympathetic fibers are regenerating, so the fibers travel via the, what happens is preganglionic fibers, postganglionic fibers via the auriculotemporal nerve. Instead of going and innervating the gland, these parasympathetic fibers of the auriculotemporal nerve might go and innervate the skin. So when it is happening in such way, then every time the person eats, you can see perspiration or sweating on the skin over the parotid gland. Okay, that is actually called as the Fraze syndrome. Okay, so the parasympathetic fibers, what happens is instead of innervating the parotid gland in the course of regeneration, might innervate the skin over the parotid gland. So that is actually called as the Fraze syndrome. Now, the parasympathetic part in humans, apart from the glossopharyngeal nerve, it is also believed chorda tympani nerve also contributes to the parasympathetic innervation. Okay, there is perspiration over the skin. Then finally coming to what is xylogram or xylography. So it is actually a diagnostic procedure to visualize the duct and the salivary gland. So a radio contrast dye is actually injected to see whether there is any block or irregularities in the duct or the gland. Okay, that is actually called as the xylography. It is called as xylography or xylogram. So that is all for today, and thank you very much for your patient listening.